Distinguishing malignant from benign autoimmune disease is of clinically importance. While we treat patients with benign autoimmune disease, usually by immunosuppressive treatment, we often consider surgery in patients with malignant disease. In this study, we investigated a marker of autoimmune disease, such as IgG4 positive plasma cells, in the tumor surrounding of malignant cancer of the biliary tree and of the pancreas. Together with our pathologist, we studied the frequency of IgG4 positive plasma cells on liver tissue of hilar cholangiocarcinoma and adenocarcinoma of the pancreas. We stained in hematoxylin eosin and in immunohistochemistry the tissue and detected IgG4 plasma cells in a tumor surrounding of up to 1 centimeter. On peritumoral tissue, we see here a Klatskin tumor with a cholangiocarcinoma. We see an infiltrate here stained by hematoxylin eosin, and if you stain it with IgG4, you see here brown points, and if you get closer to this area, you see IgG4 positive plasma cells, more than 20 per high power field, and this is normally the condition in autoimmune pancreatitis as well, but this is a staining of hilar cholangiocarcinoma. In up to a third of the patients with hilar cholangiocarcinoma, we find a high frequency of IgG4 positive plasma cells, and in up to a quarter of the patients, or here's a little bit more, 26% of the patients are positive for IgG4 plasma cells. So we have to do it with autoimmune conditions in these patients, but this does not represent benign disease. These patients suffer from carcinoma. This study demonstrates a high prevalence of IgG4 plasma cells in the tissue of carcinoma patients, in the surrounding of the tissue of carcinoma patients, and we cannot conclude that the IgG4 positive plasma cells might exclude a malignant disease. You have to be cautious with these patients, and you cannot say if these cells are present that they suffer from a benign autoimmune disease. These patients have to be treated by surgery and not to receive immunosuppression, which of course is a fatal error in these patients because the tumor can grow under immunosuppression.